Good afternoon, everyone. I am Dr. Shweta Garg, speaking from Sector 2, Mother and Child Care, Panchkula. So, today we will go discuss about the most frequently asked questions about the relation of pregnancy and the coronavirus infection. First of all, what is COVID-19 infection? Now, it's a new type of illness caused by a new coronavirus. As you all know, the main symptoms are fever, cough, and difficulty in breathing. But it can also lead to stomach problems like nausea, diarrhea, and there can also be a loss of sense of smell or taste. And these symptoms usually appear between 2 to 14 days after you are exposed to the virus. Now, the most commonly asked question during pregnancy is how does COVID-19 infection affect the pregnancy? Are the pregnant patients are more susceptible to the infection, or the risk of infection is more severe in the pregnant patient? In this, the pregnant patients are not uh, at increased risk of infection as compared to the general public. They are equally at risk as compared to the general public. Secondly, if we talk about the increased risk, more studies are needed, but till date, no report shows that the risk of severity increases in pregnancy. But definitely in pregnancy, there are some changes in the body which can lead to increased risk, but the research is going on. Now, how could a COVID-19 infection affect a fetus? So, it is too early for the researchers to know about the effect of COVID-19 on the fetus. Few studies have reported a case of preterm birth related to the COVID-19 infection, but still it is not clear whether this preterm birth is due to COVID-19 infection or due to some other reasons. And more research is needed before we can say anything. Now, what should a pregnant woman do to avoid the coronavirus infection? Now, as you all know that the spread of this virus is from person to person, and the pregnant woman has to take the same steps as the general public. That means it includes washing hands with soap and water for at least 20 seconds, or you can use a hand sanitizer that contains at least 60% of alcohol. Avoid touching your eyes, nose, and mouth. Stay at home as much as possible and stay at least 6 feet away from the people if you need to go out. Avoid people who are sick. The next question which the pregnant woman asks is whether they should cover their face or not. Now, wear a cloth face mask if you are going out in the public areas. And it is important to use a mask when you are not able to maintain a distance of 6 feet in the public areas, like if you are going to the markets, hospitals, or to the pharmacy. The next question, which is asked by the pregnant women, are whether they should come for the regular antenatal visits or postpartum care or not. Now, this you can discuss with your obstetrician and you can fix your appointment so that you can avoid the crowd. You can have fewer appointments and you can fix it with your obstetrician. You can even call them and go for online video call or for telemedicine. You can visit a scheduled you can appoint take a prior appointment and schedule it according to your convenience. Now the next question which is asked is how can I stay physically healthy right now? Now for the pregnant women, they should eat healthy meals, exercise regularly, but mind it that you should stay at home and away from other people, get plenty of sleep, and avoid alcohol and other drugs which are harmful in pregnancy. Now, how can I manage stress and anxiety during pregnancy and in postpartum period? Now, pregnancy and postpartum period, there is already an increased risk of stress, anxiety, and depression. And also there is fear and stress regarding the COVID-19 infection. So you can stay away from your friends and family, but always maintain a contact with them by phone calls, text, and online chats. so that you can stay connected and even you stay safe. But you should take an advice of obstetrician or your healthcare professional if you are experiencing these symptoms like feeling sad, helpless, hopeless, or you are having fear or worry along with you have fast heartbeat, if you are feeling that the life is not worth living, or if you have scary or unwanted thoughts, then you should immediately contact your healthcare professionals. Now, the next frequently asked question is, can I travel if I am pregnant? Now, the traveling depends upon the area you are living, and you should contact your local or state health department for further information. Now, what should I do if I am pregnant and think I have COVID-19 infection? Now, in this case, you should immediately call your obstetrician or the healthcare professionals for advice, and you should contact in emergency if you have these warning signs like a difficulty in breathing, shortness of breath, ongoing pain or pressure in the chest, sudden confusion, being unable to respond to the others, blue lips or face. Then this is the emergency signs. Or if you have any history of contact to the COVID-19 patient, you should immediately contact the health professionals. Now, what should I do if I am pregnant and diagnosed with COVID-19 infection? Then you should speak with your healthcare team. You should inform them and wear a face mask and separate yourself from the other people. The mode of delivery during labor will not change and you should deliver at a hospital setting. Now, another question which the pregnant patients ask is whether it is safer to have a home delivery in this time of COVID-19 infection. Now, in this case, the home delivery is not the safe place. Still, the hospitals are the safest place to give birth, and you should have a hospital based delivery. Now, can the COVID 19 pass to the baby through the breast milk? Still date, there is no evidence that there is virus secreted in the breast milk. So, the breast milk is still gives protection to the babies. Now, the next question which is asked is, how can I avoid passing this infection to my baby? For this, you should wash your hands regularly and you should wash your hands before touching to your baby. Wear a face mask while breastfeeding if possible. The next question which is asked is, what should I do if I am exposed to the COVID-19 at work? Now, for this, you can ask your employer how can you stay safe while doing your job. You can ask your employer for the homework or remote work if possible. And they should take care that their employees are in safe and healthy condition. Now, next is question which is asked during this time is, if you want to get pregnant and should you wait for the COVID-19 infection to go or should you conceive? Now, this is your personal choice and the decision is based on your health and the potential risk of getting the infections. So these are the common questionnaires which are asked during this period. And if you have any other question or query, you can contact us in a hospital setting. Thank you.